you very much. I'd like to begin by commenting on how much has changed in the past 2 years since we last gathered in San Diego. And I'm going to open, and on your desks, I have a report that has some of the details of what the ICA has been working on, and I'm not going to, I would like to read one passage to set the stage for some comments. And it's, in the fall of 2021, we find ourselves in situations that are not aligned with the inalienable human rights of health freedom, freedom of movement, freedom of speech. In a world of public health that promotes evidence-based decision-making, we see credible science, such as the value of natural immunity, being ignored. And it's being replaced with the totalitarian approach of compulsory vaccination as a tool to force compliance. Having this forced upon all healthcare workers in some locations, for all government employees at federal and state and provincial levels, and even as a condition of employment, and even in the ability to have a business open. We see the institution of a show me your paper systems in which private medical data is required to be disclosed in order to travel, to dine in restaurants, attend a concert, or attend a sporting event. And this is after 18 months of shutdowns, lockdowns, flattening the curve, masking limitations of speech on social media, and the cancel culture environment that is reminiscent of countries and times in history in which freedom was and is non-existent. Now, 2 years ago, who would have ever thought that that's what we would be faced with as a profession? And what I'd like to do is to comment on, there are forces at play, particularly internationally, that are trying to divide us, and maybe it's to keep us divided, because for so many years we have been divided as a profession. Right, and some of you that know me know that it's a second career for me, and for the past 25 years since I got my degree and entered a profession, I've always looked at it from a corporate point of view. And for years, I've sat there and postulated that we are the only profession that I'm aware of that circled the wagons and shot in. And it was even though I attended the 100th year anniversary when I was still a student, okay, back then you could palpate the differences and the angst within the profession. And my view is, based upon the work that you've done in the past 2 years through the ChiroCongress and the strategic planning exercise, and having gone through the identity process, what I am seeing is our profession maturing. I see our profession coming together, okay, in order to be able to move forward and to tackle the challenges that we're faced with. Now, I'd like to put in perspective, okay, what we really need to do as a profession, and as we gather and collaborate, we can do it. And here's the challenge. We need to change the public conversation from what do I do when I get sick to how do I stay healthy. We need to figure out how to become the Amazon of healthcare. We need to figure out how to lay a foundation, okay, of a new, almost a new industry with a focus on health. And that's what chiropractic is all about, right? There are forces that want to pigeonhole us into the neck pain, back pain category, and they want to force us to operate in the biomedical model, right? And sometimes I get criticized for the viewpoint of the us and the them and the et cetera. And what I'd like to point out is we're all chiropractors. And some of us operate in the vitalistic, many of us. It's different in the United States, and then it's different in Europe. Okay, but whether you operate in the vitalistic viewpoint, focused on the nervous system, focused on improving health from the inside, or whether you operate on the neck pain and the back pain, all chiropractors are providing a valuable service to their patients. And what I see happening is, as we come together, okay, we need to change that public conversation, right? And you're all doing it. And I am so excited about the work that has been accomplished since we last met 2 years ago in San Diego on the strategic plan. And I know we're going to spend a couple hours this afternoon talking about that. But we at the ICA are extremely excited about seeing our profession mature. Come together, work collectively, work collaboratively, and if it wasn't for each of you sitting out there and the efforts of the ChiroCongress, would still be back where we were 100 years ago. So I'm excited, and on behalf of the ICA, I'd like to just reinforce our commitment, okay, to continue to collaborate and work with all of the state associations, with all of the organizations in the chiropractic profession, okay, for the betterment of the profession. And so, thank you very much.